My name is Ray Babowicz. I'm the Director of Communications, Government Relations, and Marketing for Community Health Center of the North Country. I am married. I kind of grew up in between the North Country and outside of Syracuse, actually. I tell most people recently, to sum it all up really, even though it's not my official title, I'm really the Director of Strategic Partnership Development. If you think about it, it's kind of inherent in marketing and communications to begin with, and even in the role I play as the liaison for government relations. You know, it's all about the partnerships. No matter which audience you're dealing with, it's about making sure people understand who we are, what we do, and why we do it. It's really that simple. We operate health centers across the North Country. And look, whether you're a fortunate, wealthy individual or part of the underserved community, we all struggle with the challenges of transportation. And when it comes to healthcare, it takes on a whole new level of importance. I mean, we can offer the best healthcare in the world. Doesn't do you any good if you can't get there. So working with Frank as the mobility manager and working with the team at St. Lawrence County Transportation, et cetera, we have just worked on many ways to figure out how do we integrate their services to make sure our patients can get to their appointments on time and get the care that they need. Many patients in our health centers are now getting the preventive care that they need because they have a way to get there to see the doctor before they're sick. That ultimately is saving, I mean, look, obviously that's the right thing to do to begin with, but money talks. By opening up access to the care that the patients now have, we are saving the healthcare system literally millions of dollars a year just in the state of New York. And there's a big push to reduce emergency department visits, unnecessary emergency department visits, because that's costing the system and ultimately you, the taxpayer, more money than it should. So by making sure people have access to the preventive care and the primary care that they need, they're not getting sick. They're not using the emergency department for unnecessary reasons, et cetera. You know, when I was first told about first mile, last mile, when we were about to soft launch it last year, I said to Frank, I said, this program is going to have more impact on the social determinants of health than anything else we do. And look, social determinants meaning safe housing, food security, all the other things that, you know, are very important to your life. We are fortunate in St. Lawrence County. Compared to some surrounding counties, St. Lawrence County is like Manhattan. At least we have a bus route, thanks to, you know, St. Lawrence County Transit System. You can pretty much get to any place you need to go. Great. What if you live in a rural town, you know, outside of whatever, pick a town, Governor, Messina, any of us. I mean, we know how tough it is. So what if you can't get to the bus stop? You can't access the bus system. So with first mile, last mile, there's no reason for you not to get into the transit system now. Think about this. It's not just about accessing health care. This person now, maybe for the first time in their life, can go to college. Maybe the only thing keeping them from getting a college education was they had no way to get to class. They couldn't get to SUNY Canton or wherever they wanted to go. Maybe for the first time, and who knows when, they don't have to go to the corner gas station to buy their dinner. They can actually get to a real grocery store and buy some healthier food. So, you know, they're bettering their education, they're bettering their job prospects, they're obviously earning more money that way. They can get out and buy real food, maybe ultimately buy better housing, and overall become a healthier person. First mile, last mile, providing a better quality of life.